Um, so let me introduce myself. I'm not so sure there's going to be any shock and awe that, considering the fact I can't get a PowerPoint thing to work on it on Zoom. But I've spent decades and decades as a psychometrician in the test publishing industry. And just 5 months ago, joined the team here at the Burn Model Systems. And it's been a pretty steep learning curve, but the cool thing about psychometrics is that it's really a universal tool that can be uh, used across quite a few um, different types of industries: health industry, education, licensure exams, um, you name it. And uh, so that's my background. I've been doing this for quite a while, and I'm kind of the poster child for if you do something for a long time, you get pretty good at it. And so what I'm going to cover is literally today is an inch deep and a mile wide. Um, if you open any book in psychometrics, a textbook that's an intro, you're going to see chapters on reliability, validity, on test construction, item development, classical test theory, item response theory, factor analysis, and things like that. If it sounds like a mishmash of stuff, it sort of is. And I think that's why psychometrics is so hard to kind of get a grasp on what exactly it is, because it really is a conglomerate of quite a few different things. Stuff I'm not going to cover are sort of advanced topics like scaling, equating, standard setting, and things like this. So we're going to cover material that's covered in about, I would say, 8 or 9 classes, if you're wanting to get a PhD in this stuff. So, like I said, we'll be skimming along the top. My hope is at the end of this presentation that you'll have a framework for where things kind of fit, like reliability. Why do people do factor analysis? What is classical test theory? And how it kind of all fits together. I'm going to be drinking some water here. So first, just definition. Psychometrics is the field of study concerned with theory and technique of measurement. It's the science of assessment, and it's really important for decision making. Like I said, in many different fields, including healthcare. Origins uh, of psychometrics that emerged in the late 19th century and 20th century. Um, Folks were interested in intelligence, essentially, these traits that you kind of can't see. Um, the term, which fits me fine, is psycho, and then metrics for referring to measurement. Um, and so, really, the development of assessments per se really started in World War I with the Army Alpha. And what the Army found out is that you couldn't just hand a rifle to anyone anymore, starting in World War One. You had tanks. Someone has to drive the tank. Someone has to work on the tank. And so they thought we need some type of aptitude test to see who would be more qualified for these more complex types of tasks. And so from there, kind of sprung the field of psychometrics. Um, my cat's yelling at me. I have to have a plug here. About 20 years ago, the New York Times um, talked about psychometricians in this one article as test takers or test taking grows, test makers grow rarer. And so a peculiar outcome of No Child Left Behind Act, psychometrics, one of the most obscure, esoteric, and cerebral professions in America, is also one of the hottest. And so I've never been called hot before. And so, I like this not only because of that, but also yet another reason why psychometrics is so hard to put your finger on. It is obscure, it is esoteric. There's not one paradigm, there's not one theory. There's a bunch of them, and you can consider these tools to be that you can use. There's a variety of different methods and techniques and tools, and we're going to be covering the most important ones today. The really early concepts in the early 20th century kind of centered around factor analysis and the development of intelligence tests and such. And the idea here was really the beginning of latent traits. So everything that I'm going to be covering today has something to do with a latent trait. A latent trait is a trait you can't measure directly. So, for example, anxiety. If we could measure anxiety directly by asking the person and we could know the exact level of anxiety they have, we wouldn't need measurement. But we can't do that. And so we ask people questions, and those questions are designed to kind of get at this underlying construct. Well, the first underlying construct that people were really interested in the early 1900s was intelligence. And so that's where a lot of kind of things start to evolve from. Now, I do want to mention the Likert scale. It's a popular method for measurement in health sciences. And it's so important, really, that we have a picture of Renus Likert. It is Likert, not Likert. Before you could Google that, it was a big controversy, how to pronounce his name. And so, but it is Likert. And these are the scales that go, strongly disagree, agree, neutral, or strongly disagree and agree and such like that. So there's the guy that developed that. So that's a really important scale. One last thing before we get started in earnest is where do all these psychometricians live? And they live at the National Council on Measurement and Education. So most psychometricians belong to this organization. Their duty is not only to kind of promote and build the field, but also to keep it fair and equitable. And so they're very, very much strongly involved in fairness and bias reduction and things like that. So there is actually a group of researchers that and they have their own conference, their own organization, and that's called NCME. And as I say in that bottom bullet, the measurement experts work in fields other than education. They work in health science, and I'm a very new member of that. So let's really get started here. Probably the two most important concepts in psychometrics is reliability and validity. And I know that each of you have heard of that. But reliability ensures that measurements are stable and reputable. You can replicate them. And so validity, on the other hand, is the extent to which a measurement tool accurately measures what's it's intended to measure. And so these are two very different concepts. One is relatively easy. It's is this measure consistent? If you have an inconsistent measure, you can imagine chaos. I mean, you're not going to be able to even measure anything. So at the very least, you have to have a measure that is consistent. The second, validity, is are you measuring what you're actually intending to measure? This is really tough because this is where all the latent trait kind of stuff comes in. Where am I measuring anxiety or am I measuring depression? I mean, it's like things can be so intertwined. What is it that you're measuring? And so it really is, what is the use of the test? What is the purpose of the test? So a little bit more on both of these. Reliability is the degree to which assessments produce stable and consistent results. I love this sign here: reliable, trusted. In the 70s and 80s, if you were around, Toyotas were reliable. You turned the key and they started. You could trust it. This is exactly what reliability is. Now, to measure reliability, there's different ways: test retest, inter-rater reliability, that's the agreement between two different raters, and internal consistency, which I'll touch on a little bit more later. But each of these has to do with consistency. Test retest. This was one of the, I think, the first reliability measures. That is, if I give a test or an assessment and wait several weeks and give the same test or assessment to the same person or same group of people, it really needs to give you consistent results. If you get wildly different results, something's going on. Maybe there was some intervention you didn't know about, or there's something wrong with the measurement instrument itself. But that's an idea. The internal consistency, one of the most popular ones, is Cronbach's alpha. We're actually going to spend a little bit more time talking about that later. Validity, like I said, is tougher. The extent to which an assessment measures what it claims to measure. So this little validity post-it note is sitting on top of a ton of other post-it notes. I just loved when I found this, because that's what it is. Reliability, you can just calculate it using a method, and here's your reliability, and hopefully it's good. Validity, you have to essentially have a program of research. There's not a single number that represents validity. Validity is hard. Elon Musk, space is hard. Well, so is validity. Uh, Someone decides that Pluto isn't a planet, for example, that messes up the validity of your science test if you have that item in there beforehand. And so it's something that kind of always needs to be monitored and checked. And there's different ways, and we'll go over those. But just leave it to say that if someone says the validity of this instrument is this, you can probably say that with reliability, but with validity, I don't know. Validity centers so around the use of the test. Um, a psychology test might be really valid for a group of students, but you go give the psychology test to geography students, it's not valid, but it's the same test. And so it really has to do with the use of the test. So there's different ways to determine validity. There's different types of validity, and maybe you've heard of these. There's content validity and construct validity. Content validity, sometimes called face validity, and it's kind of like, it looks like a duck, it quacks like a duck, it must be a duck. And here, if you are trying to measure anxiety, for example, for burn patients, um, you the items better look like, you're measuring anxiety. Do you have anxiety when you do this? Have you ever had anxiety when you're going to public? And so the same with math or reading. You know, you write items that are specifically designed for that construct that you're measuring. And this usually, as almost predominantly, includes using expert judgment. So you have math teachers writing items, you have clinicians writing items for the surveys that are used in different healthcare scenarios and stuff. And so content validity is one of the easier ones. Now, construct validity, it has to do with kind of getting at that latent trait. Uh, are the constructs that I'm measuring, um, the ones that I want to measure. And so one way of doing that is to take your assessment and see how well it correlates with other assessments, which we'll get to that in a second. But with construct validity, let's say I'm measuring three different types of anxiety, maybe social anxiety or just some type of personal anxiety or something. And uh, you have clumps of items that measure different aspects of validity. Well, you can do an analysis to see if those items actually cling together and make sense. And so the construct validity is a bit tougher because you're trying to get at that latent trait, which of course is something that you can't measure directly. There's criterion related validity. Um, and so what you do with your assessment is that you might have some type of outcome or behavior. So you might have um, another uh, measure that is related to uh, um, to your original measure, and so you would see what the correlation is between those. Or actually, you might have some type of benchmark that is related to the assessment, and that you gather that. So, for example, you're asking about mobility or something. Well, then you can actually do a test where you actually see how mobile the person is compared to the results of your survey, and you look at those results together. And the same with predictive validity. You have these outside criteria that you trust, and you get correlations of your assessment with those. It's all about, is it related to similar constructs or the same construct being measured in a different way. um, so types of measurements. First of all, promise. This is a really good example of health outcome measure that's standardized. That's a very important thing in psychometrics. You want to have when you're collecting data, you want it to be pretty similar every time you're collecting it. If someone's filling out a questionnaire or a survey, you don't want them standing out in the rain when other people were comfortable inside your office, so you want to keep things very standard, and also in terms of the way you score it and such. And so Promise uses IRT, item response theory, and we'll talk about that a little bit later. So this is a really good example of a standardized test developed through rigorous scientific methods. um, Another thing that seems to be on the frontier here in health assessments are computerized, or the use of computerized adaptive testing. It's where the computer selects the most informative items for each person. So this leads to more efficient, precise measurement, and more importantly, reduces the load on participants. I haven't been in this field that long, but there's always this concern that we're asking participants to do too much. And so if you can shorten an assessment and get essentially the same results, that's important, particularly in the research that folks do. And so the computerized adaptive testing allows you to do that. Instead of asking 50 questions, you only have to ask 20, and it kind of hones in on on that characteristic, or on the measure of that trait that you have. Um, Another drink of water. Trying to figure out where I dehydrated myself this morning. So to have a test, you have to have items and you have to have forms. And so, kind of a big deal in psychometrics is item writing and forms construction. And there's actually some pretty good guidelines out there for how to do this. Um, but one of the main things uh, about building items that are good is they really have to be clear and concise. Uh, you don't want to get tricky or anything, because then if your items are too tricky, you're measuring something else. For example, maybe problem solving ability. So you want to make the items very clear in terms of what you're asking. Um, and of course, they should align with the intended construct, and also avoid bias. Like I said about NCME, bias is a really big thing. Every test publisher out there has bias review committees for writing items. They do statistical analyses to see if items are biased in one group, favor one group, or favor another. And so it's really an important thing in item writing. Same thing for when you uh, build forms. You have to have forms that accurately reflect certain specifications. Um, One thing in particular is that when you're surveying or writing a survey, you really want the items in there to be able to tap into those who have very little of the trait, but also those who have a lot of the trait and everything in between. And so you want items that not only are, like, for example, in the math assessment world, you want items that are pretty easy, and then you also want items that are difficult, but also a bunch of items in the middle. So you want items developed over the whole spread of that trait. So you're measuring, so you have a chance to see if someone just has a little anxiety or moderate anxiety or a lot of anxiety. So it's very important to write questions um, to cover that whole span. And of course, um, the bias is really important too. You can unfairly disadvantage groups. I know this isn't health assessment, but one of my favorite examples of this is uh, when I worked in Kentucky, there was an item on the test having to do with bicycle safety. And I was saying, well, kids in Lexington, Kentucky are going to do a lot better than those in southeastern Kentucky, because in southeastern Kentucky, riding your bicycle is avoiding the pickup truck that goes by every hour, whereas opposed in Lexington, big college town, lots of people riding bicycles. It's just different. And so I'm sure there's cases like that for sure in health assessment where you might be favoring one group, and that will just lead to inaccurate results, a mismeasure of that trait you're trying to measure. Um, well, let's keep moving here. Kind of two big topics now uh, in psychometrics are classical test theory and modern test theory, which actually is, for the most part, um, the IRT or item response theory. And so I'm going to touch on both of those at this point. So classical test theory has this idea or underlying principle of an observed score being equal to a true score and error. And this actually was, and for me still is, just profound in its simplicity, but also in how important it is. So I have an observed score, and like I said, if it matched the true score, we'd be done. You would have your answer. But observed scores don't include just the true score that you're looking for. It includes error. And this error is random error that's uncorrelated to any of the scores. And so that's why a person who takes a test and 2 weeks later they take the same test, they might get a different score because there's error involved. And so from that idea, reliability can actually be defined. And so if there's a takeaway from for today, it's this: like, what is reliability? And theoretically, it's the correlation between a test score and the true score squared. And so it's a variance. In other words, it's sort of the amount of overlap between my score and truth. Um, and if you take if you take the formula here for the scores, turn them into variances, uh, you can see on the right-hand side of that formula that the true score variance is divided by the true score variance plus the error variance. So you can see that starts giving you an idea that, oh, the higher that number, for example, as the error becomes reduced, and let's say it just goes away, you have a reliability coefficient of 1 because there's a match between your true score variance. All you're measuring is true score variance. That doesn't happen very often, but it does give you the idea that, well, 0.89, 0.8, 0.9 is probably a pretty good reliability because that's how much of the true score variance that I'm measuring. So once again, we don't know truth. It's a trait, and so it has to be estimated. Um, and reliability coefficients do that. So inner coefficient alpha, if I were to theoretically take a test and split it in half as many times or many ways as I can, all the split halves of a single test, and got the average, that is actually what coefficient alpha is. So it's actually a little bit of an underestimate of reliability. Um, so, and I have this one little thing here, this little guideline, and it's not too far off. If you have a reliability that's above zero point 0.9, yeah, it's above zero point 0.9, that's usually pretty good. And it typically takes kind of a long test, with maybe 40, 50 items. Uh, the number of items is directly related to your level or degree of reliability. If I have a test that doesn't really have high stakes involved. You're not making a decision per se about someone's healthcare or someone's promotion to another grade. Um, Point 0.8, point 0.9 is probably good enough. Point 0.7 to point A is probably good enough for a subtest, or subpart of an assessment isn't going to have as many items, and so it's going to be less reliable. But because it's just a subset of items, point 0.7 to point 0.8 is probably okay. Anything under point 0.7 really, or under point 0.7 really is questionable. You want to be real careful about what you do with an assessment that has that low of reliability. Remember, it reflects that there's low consistency from one administration to the next, and that's not good. Um, and sometimes it means that something happened between the two times that you tested. For example, if you're doing a test retest. Item response theory started being developed, I guess, really in the 50s and 60s. And when people mention modern test theory, this is what they're referring to more times than not is item response theory. This is where it gets really heady. That one thing, esoteric and such. You can actually put people and items onto the same scale, and typically that's when uh, uh, that's typically when things fall apart for people. Like, what, you put a person and an item on the same scale? What's that even mean? Well, people have a measure on a latent trait. Well, items also have a measure on that latent trait. So you can see that you can take the latent trait and you can graph the two, where theta is the amount of ability, and this probability of endorsement is the probability of answering an item in a certain way with less of the trait or more of the trait. If you're talking about a test score in math, less math ability versus more math ability. If you're talking about anxiety survey, less anxiety versus more anxiety. And so that's the really cool thing about item response theory. Classical test theory is only centered on tests, not on items. Now, that being said, you can look at the percent of people getting an item correctly or how they score on a particular item and use that data to build a scale, but it's not tied directly to classical test theory. It's just something that's sort of related to it. With item response theory, you have mathematical models that specifically tie an item to a latent trait and to a person's ability. And this was a huge advancement in the field. I can't tell you. This allowed for so much better measurement that it's just hard to even describe. You could now have different forms of a test, and you didn't have to worry about that one was more difficult than the other. And so for those of you who took the licensure exam, um, I'm old enough to where you probably took a test that was developed by someone I know, because I know a lot of people. There's a lot of psychometricians that work in the licensure exam business, but it was a big breakthrough. Um, I'm going to go through these slides here because this is stuff that it's hard to present in 5 or 10 minutes because um, it's just more in depth than a lot of other techniques. But the main thing is you're measuring a latent trait, and we've been measuring latent traits this whole 40 minutes, well, or 30 minutes because we got a late start. But one of the things important about item response theory are item characteristic curves, and this is an item characteristic curve. And the B at the bottom of the graph, that's actually the level of difficulty. The A has to do with discrimination. You want items that discriminate between low values and high values on that latent trait. And the C parameter is one that I don't have it really, I have random guessing listed here. That is actually a C parameter. This picture here is of a one parameter model, and so it does not have the C parameter in there. And so the one parameter model uh, assumes that all items have the same discrimination parameter, which is really bizarre and turned a lot of people up on top of their heads there in the 60s. Like, how can you have a model that doesn't take discrimination, item discrimination, into account? And people weren't buying it, but the research has shown that the models work quite well. There's a lot of people in different industries that use the Roche model or the one parameter. There's two parameter model, and that has discrimination in it. And then the three parameter has three parameters, has discrimination, difficulty, and random guessing. Now, another person has made the highlights in terms of a picture. We had Dr. Lickert, and now we have Fumiko Samajima. And I have her on here because one of the more popular IRT models used in health assessment, at least that I can tell in my little young career here, is the graded response model. And she was just a fabulous psychometrician. I think she passed away, might have been even like close to 10 years ago. I think she's in her 80s. Just a remarkable psychometrician, just really a mathematical type of person. And she created this graded response or derived this graded response model. And this is the model where you use like a Likert type scale, strongly agree, disagree. It's things they're really common in surveys, particularly used in healthcare. And so this model gets more complicated because you have uh, essentially a group of item characteristic curves within the same item and such. But kudos to her. It took years for psychometricians to be able to estimate the parameters for this model because it was much more complicated than the previous models. So IRT is great for item selection. You can compare items in terms of where they are on the latent trait scale. By the same token, with test construction, you can take a group of 10 items and compare it to another group of 10 items, and they're all on the same latent trait scale, and you can see how they relate. I hope you're seeing how really cool this stuff is in terms of being able to understand your items, how it relates to that underlying latent trait and such. And so I mentioned adaptive testing early on. IRT is the foundation for computerized adaptive testing. You could have it without IRT, but it didn't exist very much before IRT. And so if you're taking an adaptive test, there's 99.999% probability that there is an IRT model underlying the administration of that test. And basically, what it does, now that you know that an item is on the latent trait scale, it finds out where the person is on that scale, and it starts to look for items that are at that same person's ability or same person's level of the trait. And then you can go from there and get closer and closer to where that person is on the latent trait scale. So, really, really cool stuff. Uh, in terms of score interpretation, a raw score, let's say I just have a raw score on something, and I'm like, have 40 points and someone else has 30 points. It's like you don't really know what that looks like on the other underlying scale if you're just looking at raw scores. But in terms of IRT, the IRT results are put on that latent trait scale. Um, I know that one of the groups I work with here at the university likes to have a mean of 50 and a standard deviation of 10 when they develop their scales. And so it really puts the score itself into a much better perspective in terms of what it's measuring. And so, with that being said, that sounds a lot like validity. And yeah, so IRT is really helpful for determining or looking at validity and also reliability. Reliability in IRT has to do with a lot with information. You can see how much information an item is giving you related to the underlying trait. And so that's very, very useful. So statistical methods, I tell you what, I'm going to kind of run along here so we can have some questions and answers if we be plus uh, I guess after this presentation I'll be hydrated. I don't know. So, uh, but some of the first things used in psychometrics was these methods to get at the underlying trait, and so these are standalone methods that have been used for for close to 100 years now. Principal components analysis and factor analysis. Um, One little common mistake that seems to be made a lot is that a principal components analysis uh, essentially takes the data and it puts an eigenvector through there. And then the next eigenvector you put through is uncorrelated with the first one. And so it's not talking about really what the data is. It's just saying, here's where all this variance is in terms of this first dimension. Here's all this variance in the second dimension and such. It's not until you rotate a principal components analysis that you actually get factors that you can name or understand. And so actually factor analysis is usually called common factor analysis because it's looking for common variability amongst the items. And that's actually what the factor loadings tell you when you look at one of these. But I just wanted to mention that factor analysis is still used in different ways. I just ran one a couple of weeks ago for some folks. And so still used today, very, very useful because it's helping you to understand that underlying latent trait. Applications, I've been talking about applications just about the whole day here. It can be used um, certainly in health and the cognitive abilities and mental disorders and guiding treatment plans and therapy outcomes and such. And then uh, I didn't want to talk about ethical issues too much because you guys have probably forgotten more than I know. And you have boards that evaluate the research that you're going to do, and so I can go through ethical issues, and informed consent is absolutely what you need. And fairness and bias, we've kind of talked about before. And guess what? In terms of trends, let's see, AI. Let's apply AI. In psychometrics, it's kind of interesting that computerized adaptive testing um, is a form of artificial intelligence. The machine is deciding what is the next best item to give this examinee. And so psychometricians have been doing AI for a really, really long time. I'm curious about its use now. I know people are using it, but for example, you could use AI to take a first crack at writing an item, but there's very strict policies in terms of um, getting permissions to use items. They're copyrighted. Usually have copyright material, and if you have copyright material and you're giving an item, um, you're taking chances if you haven't gone through the proper channels there. And so, uh, you know, artificial intelligence just confuses me because of the copyright violations. But anyways, certainly there's a lot there that will be discovered in the next years, I'm sure, of to be very useful to the field. Um, and big data is everywhere. I tell you, Kara, if we can open things up to some questions or comments or such, I think that would be good. Give me a chance to get another drink of water.
Absolutely. Thanks so much, Bill.
Oh, sure.
Yeah, we'll just open it up, see if anyone has any thoughts or questions. Doesn't seem like we have a
Oh,
ton
there
of
we go.
questions.
There's a
Elizabeth?
fan.
Were
There's a
you,
fan. My cat. I was wondering if you guys could hear my cat, meowing outside the door. Uh,
Elizabeth, did
the,
you have a question? You're unmuted.
Oh, sorry, no.
Okay.
I
No.
have a question, perhaps for the group. I mean, are you guys? Do you use any psychometrics, or do you have folks you work with that are psychometricians?
I think for the burn model system folks on the line, it's we're the psychometricians. I can't call
Well, the
myself a
answer is yes.
psychometrician, but
The answer is
certainly
yes.
Dagmar and Alyssa and you.
Yeah. Yeah, and I'm still learning a lot. Like I said, I was in education for decades, and I would never pass myself, for example, as a content person, as a math content person, reading content person, and certainly not as a clinician. So, it kind of speaks to psychometrics and how flexible it is to be able to kind of transcend different types of work that people do. So,
Yeah. It never occurred
well,
to me too. It's so funny that you brought up that Psychometrics has been using AI for a long time now. That of course, but that never occurred to me that that's AI. I like that though.
yeah, it is, and so Do we have a head start? I don't know.
Interesting. Yeah.
There's a question. Yeah. So, well, Kara, if there's no questions, uh, certainly sorry about the delay at the beginning. I'll take full responsibility. I'm an old guy, and it's like, I've never been able to figure out how to get this stuff working. So
Well,
you can
no
get it. At
worries.
least you got a peek at the slides before I did them. So I kind of like that. So
Well, we made it work, and thanks everyone.
okay,
We will be posting this on our website as well. So when that's up in a few weeks, I'll send that out to everyone who's on here. And thanks for attending. And thanks, Bill. That was really interesting.
oh sure. Thanks. Bye, folks.
Bye.